Good afternoon, everyone, and welcome to today's webinar on Applemar's dashboard, past, present, and future. It is my pleasure to moderate this very important discussion that we have on the agenda today on the importance of data for evidence-based decision-making and dashboards as an accountability tool for malaria elimination in the Asia-Pacific region. To begin, please allow me to introduce myself. My name is Anushka Mangharam, and I am the Associate Director for Evidence, Insights, and Policy at Applemar. Applemar, or the Asia Pacific Leaders Malaria Alliance, as you are all probably well acquainted with, unites 22 governments in Asia and the Pacific to accelerate progress towards malaria elimination in the region. Applemar works closely with national malaria programs, partner organizations, and stakeholders to provide strategic leadership, advocacy, and technical support in the fight against malaria. Through its collaborative efforts, Applemar aims to strengthen regional coordination, mobilize resources, and promote the adoption of innovative approaches to tackle the challenges posed by malaria. And by leveraging data and evidence-based decision-making, Applemar strives to enhance the effectiveness of malaria interventions and accelerate progress towards a malaria-free APAC region. As the APAC region works towards the goal of eliminating malaria, we can all agree on the importance of data to drive evidence-based decision-making and the importance of dashboards to allow for the close tracking and monitoring of progress in the region. In today's webinar, we are lucky to have three very exciting speakers to share their experiences with data and dashboards. Our first two speakers, Dr. Helen and Mr. Radi Trai, will speak to the experiences of Indonesia and the greater Mekong sub-region on how critical data and dashboards have been to track malaria in their respective regions. Our third speaker, who happens to be my colleague Sean from Applemar, will discuss data and dashboards from Applemar's regional perspective, focusing specifically on the Applemar Leaders Dashboard, which was launched in 2015 to capture key metrics and policy indicators on malaria in the region. Over the last 9 years, the malaria landscape in the Asia and Pacific has evolved quite drastically, causing Applemar to relook at some of the needs and capabilities of our dashboard and attempt to refresh it to a degree in consultation with key stakeholders. I invite you all to listen with keen attention to the upcoming presentations and participate actively by asking questions in the chat. And we will have time after the speakers present their respective presentations to discuss some of the questions that have been brought up. So without further ado, I'd like to introduce our first presenter for today. Dr. Helen is the head of the malaria unit at the Directorate of Communicable Disease Prevention and Control at the Ministry of Health in Indonesia. Her presentation today will discuss a cross-border project between Indonesia and Timor-Leste, one of the key activities of which is the development of a data sharing mechanism and dashboard. Dr. Helen, I invite you to begin your presentation now.
Okay, thank you, Anushka, for the opportunity for Indonesia to share our presentation. I will share my PowerPoint from here. Yes. Yeah. Yes. Thank you. Can you see my slides?
Yes, okay. Dr. Helen, we can.
Okay. So this is the Indonesia, like every countries have a goal to achieve malaria elimination in 2030. And also, of course, the integrated approach present as a promising avenue for accelerating disease elimination efforts and achieving better health outcomes for population, specifically in Indonesia. And this is the mandate of our national strategic program in Indonesia, 2020 and 24. And then we have addendum until 26 with a general objective that we also already achieved, that we have less than 3% of high endemic area in Indonesia by 2024, and all the specific objective like achieve the number of district with API more than one per mil is 61 in 2018 and 20 at the end of 24. And also our specific objective in our national strategic plan is reduce the positivity rate of Papua province by 70% in the end of 2024 and increase the number of malaria-free district from 285 district in 18 and 405 in the end of 2025. And now we have already achieved 399 district that achieve malaria elimination, and we still have time until end of 24 to achieve 405 districts. And also malaria elimination status keep maintained in the district determined to achieve malaria national elimination from WHO. And to achieve all these specific objective, we have like a 4 pillar of strategy. And first about the ensuring universal access. Second about the transforming malaria surveillance as core intervention of malaria elimination. Also improve enabling environment to ensure the malaria elimination achievement through BCC and also community engagement. And four, about the strengthening the health system to achieve malaria elimination program based on equity, human rights, and no one left behind. And this is Indonesia have a specific elimination system, and then we have 514 districts and cities in Indonesia in a different endemicity situation. So we determine the intervention that carry out specifically related to the endemicity stages. And we have four stages out of 4 phases in endemicity. First, we have acceleration phase and intensification phase, elimination phase, and maintenance phase. In acceleration phase, also, of course, we have goal to decrease the malaria cases as fast as we can with the target area with API more than 5 per mil. And the main activity mostly in vector control, like for LLIN or long-lasting net, insecticide net, and indoor residual spraying. And also we have a screening routine for pregnant women and children under 5. And in intensification phase, with the goal to eliminate the foci area, the target is API 1 to 5 per mil. Also, the main activities mostly to vector control like LAINs, but an MMP, and mostly in foci areas. And also, we also keep maintain for the finding active cases, and also and IRS we do the IRS, but only in the district which occurs increased malaria cases. And for the 2 phases, like elimination and maintenance, we are doing the activity that we are doing mostly in surveillance, like migration surveillance and epidemiology investigation. We have epidemiology investigation 1 to 5, 1 in 24 hours, 2 times 24 hours, and 5 times 24 hours. So these 2 phase we are doing mostly in surveillance system. And this is the map of endemicity in Indonesia in situation FVC in this screen that the concentration of malaria cases in Indonesia is mostly in Papua. And in 2023, cases reached as 418,000 cases in Indonesia, and 90% of these cases is coming from Papua. So we can imagine how that big burden of malaria in Papua. And besides Papua, we also have area with the high endemicity, which are Sumba Island and Entity, and also the PPU or Penajam Pasir Utara, which district in East Kalimantan, which are close with our new state capital is Nusantara. So this is also the challenge for Indonesia. And this is are the regulation as an umbrella for all program activity in Indonesia. And if you see in the last point is about MOU between Indonesia government and with the RDTL or Timor-Leste government that signed on February 2022. And this is the MOU between Ministry of Health of Republic of Indonesia and Ministry of Health of Democratic of Timor-Leste. And the MOU not only for malaria, but MOU is also for all health cooperation that has been signed by Ministry of Health of two countries on 4th of February 2022. Now, if we speak about the cross-border between Indonesia and Timor-Leste, you see in the screen is a map of entity province which have a border with Timor-Leste. Maybe I can show to the okay. These are the districts that have border with Timor-Leste. This is Indonesian district of Belu and also district of Malacca that have border with Timor-Leste. If you see in the screen, there is the data from 2022, where in Belu district still in color of green, it means it's low endemicity, and for Malacca district have a yellow color, it means that in moderate endemicity in 2022. If we see the map at 2023, this is the Belu district from green turned to white. It means the Belu district has achieved malaria elimination and get the certification of elimination in 2023. And also the Malacca district with the green color, it means the Malacca is now is in low endemicity. It means the risk of Timor-Leste as a country that almost achieved the national elimination is also low because the surrounding area or borderline area with Timor-Leste now is already eliminate then and also in low endemic area. And this is the total cases in province, entity province in 2023 is around 6,000, but mostly the cases is coming from Sumba area. As we see in Sumba area, we still have high endemic area, which is in Timor East Sumba and also in Southwest Sumba. So this is the district that borderline with Timor-Leste, with Malacca, borderline with Kovalima, and also Belu borderline with Bobonaro, and Kupang borderline with Okusi, and Timur Tengah Utara and Timur Tengah Selatan also borderline with Okusi. So but in our new dashboard that's now still in developing, we are capturing a situation in Belu, but it's not just for Belu. In the future, we will use the dashboard also to all the districts that have border with Timor-Leste. So for the developing of our dashboard in terms of our cross-border collaboration with Timor-Leste, the milestone that we has achieved that the MOU has already signed by 2022. And for now, we are working on for the joint action plan is on progress, and integrated program services is still on progress. for the target is integrated. We will have integrated malaria program services in cross-border area with some key indicators like API less than 1, and then output indicators, the percentage of laboratory confirmation, percentage of treatment of malaria cases, percentage of epidemiological investigation of cases, and also the process indicators that we has also already determined is frequency of regular meeting between Indonesia and Timor-Leste, availability of trained staff in case management, and laboratory surveillance at the healthcare. This is the time when we are gathering to discuss in several things that we will that will be in our new dashboard, like a malaria screening on selected criteria, cross-border traveler, sharing data mechanism by a dashboard and WhatsApp group, and sharing vector control data and also activity. And we also have regular meeting between two countries, cross notification through migration surveillance and EIC in local language and socio-cultural. These are that we are discussed on November in 2023, that even that venue in Atambua, that cross-border also with Timor-Leste. Nah, if you see in this screen, this is the dashboard that we developed for cross-border activity. The main point in our dashboard is involving the international health regulation focal point from each country. So everything that happened in the dashboard for notification, new cases from both country, it should be involved the HSR focal point. That it's also already become a commitment between Indonesia and Timor-Leste in 2023, and the data sharing mechanism is about the routine epidemiology data and also data that urgently need attention, like if we have malaria import cases or outbreak. And this is a dashboard 2. If you see in the screen, we have 5 of panel that we can input the data in these 2 panel. It is this panel malaria form for aggregate data and panel from malaria form for notification data. From the data that we get from these 2 panels, the data we can see in these 3 panels, which is malaria map and malaria time series, and also in malaria notification. This is a dashboard that we are developing now. And with this is also this is the updates. Maybe we already developed this from the scratch is from February 22, and from the MOU, and then we are doing visiting in 2 countries, and then we are doing kick-off in 2023 from February with cooperation with Universitas Gadjah Mada in Indonesia, and with the support from APAMAL. We have many progress in every month. Like every month we are meet with the UGM University also, and also with the Timor-Leste side. And this is the update from February 24, when we have a review of joint plan proposal sharing data notification of malaria cases in Indonesia and Timor-Leste, and follow up with meeting from Belu District Province in October 23. This is the follow-up of the October meeting. And the last updates that we are doing now in April 24, besides developing data sharing mechanism and dashboard by Gadjah Mada University, from now on we are still in progress in training of data sharing using dashboard. From this week, we are trained in Indonesia side, and for the next week, UGM will train the Timor-Leste side, and then after we already get the train for the staff, and then we will gather to trial the dashboard. Yeah, This is the display of the dashboard. If you see in the upper picture is about the map. This is a map view that can describe the status of endemicity, case notification at village level. If there are several malaria indicators that can be seen in this picture as API or PR or EBER. And some of these indicators can indirectly provide an overview of malaria implementation activities in that area. And if you see in the low picture, this is talking about this time series, about the data that we get from malaria notification data. And then the data is about the Plasmodium falciparum, and then Plasmodium vivax, and then for the green line is about the total cases that we found in both countries. So this is the notification flow. Maybe I'm so sorry because this is still in Bahasa. Maybe I can explain. For the left side, this is about the reporting from this is cases in two countries, Indonesia or Timor-Leste, and then we will discuss it internally, and then after we we follow the report from the health sector, and then we bring it to WhatsApp group. This is the notification flow in WhatsApp group, and we will remain the HR focal point for both country as a lead, and then after we have the information, and we will follow in our both country about this situation. And after we are discussed in both country, we get the classification of cases, we get the number of cases, or any data that we get from each country, and then we will bring it back to WhatsApp group where ICRL focal point will declare that cases or notification is closed because we already process in both country. This is the flow of notification status. And in our task force, it's not only from Minister of Health or health office in this provincial or district, but we also involve the other ministerial like foreign affairs minister and let's see. Okay. Representative of Assistant Deputy Cross Border Management or BNPP, is from Province Health Office and also District Health Office, and representatives of cross region from West Timor, and also for Timor-Leste side, they involve the representative of Department of Communicable Disease of Timor-Leste, representative from National Malaria Program Timor-Leste, and also from municipality in border area in Timor-Leste. And from Timor-Leste also involved the National Institute of Public Health of Timor-Leste and representative of WHO as a technical partner, and also representative of Global Fund. Maybe it's different type of communication of coordination in each country, because in Indonesia will involve more sector that could be working together in cross-border area. For the last this dashboard, we built to respond the cross-border problem about the malaria, and then also this dashboard firstly about the malaria early warning system, and this can be an additional disease early warning system for border area in anticipating the occurrence of introduced cases, and also for the dashboard for the sustainability cross-border cooperation. If even the support from Palma, like example, will finish, but we will continue the process for the cross-border Indonesia and Timor-Leste, and also this dashboard as a tool of documentation, because we have so many data that we input in this dashboard, and the dashboard will exchange the malaria case notification between Indonesia and Timor-Leste, not only for now while the support is here, but until there's no support, we hope that this dashboard can be used as a tool of our documentation, even for Indonesia or Timor-Leste. Okay, thank you. Maybe that's all for my presentation. Back to you, Anu. Thank you.
Thank you so much, Dr. Helen. I think that was a really insightful presentation on what it takes to work together with neighboring countries, and the rich amount of data that you've already been able to capture and the insights that the dashboard is able to display. Also, of course, the time and participation and effort that is required to establish something like this is truly commendable. We do have a lot of questions about your presentation, but we will address the questions towards the last quarter of this webinar. So without further ado, I'd like to introduce our next presenter for this afternoon's webinar. Our next presenter is Radi from Cambodia. He is a technical officer at the WHO in the Greater Mekong sub-region, and he will share with us a presentation on the Malaria Elimination Database, the MEDB, that was established in 2014 to facilitate data sharing between national programs, partners, and malaria stakeholders in the Greater Mekong sub-region. So thanks, Radi, for coming to us with this presentation today, and over to you.
Yeah, thanks a lot, Anushka. So let me start from the first slide. Yeah, so today I would like to share the lesson learned that we have had for malaria elimination database, MEDB, that hosted by Mekong Malaria Elimination Program since 2014. So let me brief a little bit about its background. So the platform was firstly established in 2014 as part of WHO emergency response to artemisinin resistance, that in short we call ERA, with the name at that time Regional Data Sharing Platform, because the aim of establishing this platform is to facilitate data sharing between all malaria national program in Greater Mekong and the partners. And later it had been renamed to Malaria Elimination Database, MEDB. In the beginning, it used business intelligence, BI, and then later on, 1 year later, it switched to DHIS2 platform. And the MME program continue host this database and support from Global Funds in RAI, and until now RAI 4, so it's 4 grand already. And GMS country still continue reporting their monthly data to this platform to facilitate data sharing between all national program and partner. So how this sharing happens? So it has been a political commitment from all the country that firstly established in December 2017 in Naypyidaw, Myanmar, that all minister and or representative of minister from the Greater Mekong country come and sign their commitment to eliminate malaria by 2030 in the Greater Mekong sub-region. And one of the clause in this ministerial call for action is a chain core surveillance data on malaria. So that political commitment have a lot in this sharing purpose. And here is a summary of the level of data sharing from each country. So Cambodia and Laos share by facility levels, and Myanmar by township level, Thailand by sub-district level, that is equivalent to commune levels, and Vietnam is still by province, which is still high, and Yunnan by county level. Here is a snapshot of the dashboard in the platform for each country. that mainly for some indicator like API and your blood examination rate, test positivity rate, number of plasmodiomic, VIVAX, and malaria death, and the other indicator. So we have dashboard for each country plus some dashboard for monitoring the cross-border. Like now, for example, the Thai-Myanmar border, which is the hotspot in the regions. Here is a snapshot of the data flow and use in the database. So the platform receives monthly data from each country every month. That before it's receive 1 month delay. For example, now it's May. It just starting receive April. But since we have agreement from some country, not each country yet, like Cambodia, Laos, and Thailand, in the surveillance meeting organized by WHO last year, that these 3 countries, the database is ready, the national database is ready for sharing the daily data updates. So then we have started to work data synchronization from these 3 countries to this AmiDB platform. And now we have done 2 already, Cambodia and Thailand, and Laos is almost done. So soon we will have also Laos daily data update from Laos. And the other still going by 1 month delay. The objective of the platform is mainly, as mentioned earlier, is to facilitate data sharing between national program and partner, as well as malaria stakeholder working in GMS. And the access to this database have been provided to the focal point of national program and partner working in GMS. And the data in this platform have been used to monitor the elimination progress at regional level. Share the data and updates through the epidemiology summary that the data source is coming from this platform, as well as the annual bulletins. And also used to inform advisory body like Regional Steering Committee and Malaria Policy Advisory Group AMPAC that's organized 2-time meeting every year in Geneva. So the data of this platform have been used to inform this kind of advisory body for decision making, and also for information sharing, as well as support regular coordinations. So how data in this platform support in malaria elimination in GMS? So data in this platform have been used to monitor progress at regional levels, especially along border, and also serve as a sharing platform between national program, and not only at national level, but also at subnational levels that WHO coordinate to train each country at subnational level to how to use to see the progress of malaria in another side of their country, and inform advisory body like OSC and AMPAC, as I mentioned earlier, and also support in deploy the resources in the right places. For example, in the early RISE-3, one of the grant operable funds, that data in this platform has been utilized to determine where to deploy the implementing partner. Because at that time, there is one package at regional grant to deploy the implementing partner working along the border. So data in this platform have been used to determine where to deploy this partner. This is one example, and it's also used to analyze the requested analysis by WHO by independent monitoring panel, that is the Global Fund Monitoring Panels group, and driving intervention according to epidemiology, and also support the regular coordination, for example, like WHO field mission and provide recommendation, etc. This table is just a summary on the availability of data in the platform so far. So mostly we have case management and case investigation related data, but foci investigation data is still missing. And that is what the WHO is now advocating, also mentioned in the Switzerland meeting last year to all the program. And they have asked the WHO to submit the official letter to national program for this last sharing of foci investigation data. Because the format of sharing is not the same, the other data that we have received, it's not aggregate, but for foci, it's the quite detail of each foci data related. For example, like the foci name, like village name, lat long, and then the classification of the foci, etc. That is, we need another sharing, I mean, the data formats. So there is some improvement so far for data collections. We have the inclusion of drug-resistant data from the Greater Mekong country, also now included in this platform. In addition to the epidemiology data of malaria we have, and the daily data synchronization from the 3 countries that I mentioned in the beginning, from Cambodia, Thailand, and Laos, that before we have 1 month delay, but now we have daily updates. So data have been pushed from national databases of these 3 countries, but now we have done only 2, Thailand and Cambodia, and Laos will be done soon. Every night push to MBDB. So all the user access to this database can receive the most up-to-date of the status of malaria progress in these 3 countries without delay. An inclusion of the monthly data from implementing partner in Myanmar that before we missed, but now we have included. And as some of you might know that they play a very important role in Myanmar for the implementing partner, because the case detected by them is much more than the national program, since they have worked in a very remote where the malaria case happens. And the availability of elimination investigated and classified cases from Cambodia, Laos, Thailand, and Vietnam, also Yunnan's. And the breakdown by age group, gender, and then reporting unit like health facility, community is also available, but it's still aggregate. And the utilizations, we have provide access to all national program and partner, and also including sub-national levels, mostly target along border, and the epidemiology summary app that have been developed in MBDB. So user can access this without delay. In the same time, we still have some challenges, mostly on data collections. As you might aware about the reporting, the issue in Myanmar. So this issue impact the timeliness of reporting to the platform, because it's also causing delay in national database. So as a result, it's also delayed to MBDB. And the inequality of data sharing level, like mentioned in the second slide, about level of data sharing from each country. Not all the countries share the same levels, but mostly almost the same, except Vietnam, that is still quite high, it's provincial level. We may need some more time to advocate to get a bit down to like district or commune level, so that we have almost the same level for each country. And this is the way forward, the plan for the platform in RIFO. So we have planned for the drug-resistant inclusion, which we already done, and the enhanced data use and analysis that we aim to do, develop a mobile application, because now the dashboard is only available in the web-based, which through the user trackings action, we observe that not all users use. So we think that it's better to bring this to closer to them. I think on the mobile, it's very convenient for them. So we will aim to develop the mobile applications, and it's would be better because now we also receive the daily update from some country. And improve data collection by develop the synchronization services from the national databases that already ready to push data to AmiDB daily basis. So that's why we don't have delay, and then it's improve a lot in timeliness of reportings. And the country support that is specific just to Myanmar. That's MME program support in integrate the surveillance system in Myanmar. So this is also one of the plan in this year. Here is the continuous slide from the previous slides, the timelines of the plans. So Q1 is increasing of track resistance, which we already done, and mobile application ready by Q2 will be done soon. And Q3 and 4 is the synchronize of one national database to AmiDB, and the plan of alert service, it's like e-warning. See, now we have received daily update from 3 countries already, so it might make sense to have this just to raise awareness of what's happened at, like, for example, at this sub-district level or health facility level in these 3 countries, and so that we can follow up and take actions. And then from Q2 2025, it's the same until 26 is the develop the synchronized service to AmiDB from all national databases. This is not technically problem, but we need advocacy, strongly advocates to convene all programs to share this, so that we can make daily push of data like the 3 countries to AmiDB, I mean for the remaining country. And anyway, we need some further support from each program. The foresight data that I mentioned that we still miss in the platform, and the synchronization permissions from the national program that have not provide green light for this synchronization permission yet. And the lower level of sharing mostly to Vietnam, that's still high levels, it's a provincial. That is the request that we plan to do for the country. The presentation finished, so thanks for your attention, and wait for the questions. Thank you.
Thanks very much, Radi. That was a great presentation and a good reminder of how things evolve, and like how the GMS region has gone from, you know, a lesser frequency of data collection to almost daily updates, and that's just really impressive. A good reminder to everyone on how these things progress. So thank you for sharing that. And as always, please leave your questions in the Q&A function of Zoom or in the chat. And as we move along, we can either address them directly in the Q&A box, or we'll take them at the end of the session. I also want to just, before we move on to our third speaker, we are going to go over the hour today. So I hope you can stay on for as long as possible, because we have a very rich discussion going on in the Q&A box. And I'm sure that the opportunity to ask presenters questions after our third speaker will also present a lot of very interesting insights. So without further ado, let me introduce our final speaker for today. So our final speaker for today is Sean from Appelma. Sean is a senior officer who oversees the data and evidence work at Appelma, and most recently he undertook a very impressive task of refreshing the Appelma Leaders dashboard in consultation with some key stakeholders. His presentation today will focus on the changes made to the Appelma Leaders dashboard to inform evidence-based malaria elimination work in the region and plans for the dashboard's future. Over to you, Sean.
All right, thank you so much, Anushka. So, hi everyone, I'm just going to share my slides. So if you guys give me a second, Here we go. I assume everyone can see this here. All right.
Yes.
Okay, well, I just got to say I'm a little bit nervous, not because of the public speaking part, but because the previous two presenters did a phenomenal job and their dashboards are pretty amazing. But anyway, I think ours is pretty good as well. So without further ado, this is AppleMa's dashboard, past, present, and future. So as I'm sure all of you are aware, AppleMa's dashboard started with the malaria elimination roadmap developed in 2014 with these 6 priorities over here. And the idea behind the dashboard was simply for us to track the progress towards achieving these 6 roadmap priorities. And of course, I'm certain everyone here is familiar with AppleMa's current dashboard, and this is what it looks like. So we have a whole bunch of indicators at the very left, all accessible through drop-down menus. We have a map that you can click on to access what various countries are doing, and these countries change color as you select the indicators. And of course, you can also select them through the checkboxes at the right. Now, one thing about this is that we feel it is simply inadequate visualization of the malaria situation in APAC. So our current indicators focus mainly on malaria elimination policy efforts, showing most countries to be on track or in progress in the malaria elimination efforts without capturing the evolution of progress in the region. So it doesn't matter if you struggled for 10 years or 5 years trying to solve the problem. If it's a no, it's a no. And we feel that's not really fair to the countries that put in a lot of effort in trying to eliminate malaria. Also, the indicators I showed you earlier are simply not granular enough to continue being adequately informative for policymakers. Policymakers want to identify gaps in efforts to achieve elimination, and honestly, we don't think our current metrics are good enough for that. Countries also report various overlapping malaria elimination indicators to WHO for the World Malaria Report, and this creates a double reporting burden that we also aim to eliminate. All of that on top of the fact that honestly the dashboard is not really very intuitive. It doesn't really make sense if you don't know what you're looking for specifically. If you've never really used it before, it might take a while for you to access the indicators that truly matter to you. And so we have revamped our structure a little bit. While the leaders dashboard in the past has served its purpose of tracking the various roadmap priorities, it hasn't seen a large-scale refresh since its inception. And as part of this project, across 2023 and 2024, we're working to improve the capabilities of the dashboard with a focus on illustrating the evolution of elimination in the region. Well, there's a lot, and improving the granularity of the current indicators. So as part of this process, AppleMa recently carried out multiple consultation sessions and feedback sessions with stakeholders, both internal and external, including national malaria programs and experts. And through all these feedback sessions, we identified a need to restructure the dashboard. We want to facilitate comparison of relevant metrics between countries with similar disease burdens, so countries and their peers, essentially, and to present in more detail indicators of specific thematic areas related to malaria elimination. Now, if you look at this diagram on my screen, you will see number 5 and number 6, financing cross-border. These are examples of thematic areas that we focus on. And of course, this will expand over time, and I'll go into that a little bit later. So feedback received from our partners led to us reorganizing our data into 7 tabs. So this dashboard is built on Tableau, which is a very powerful data visualization software. They didn't pay me to say that, but that's what it is. The leaders dashboard is, of course, the landing page of our dashboard. It features an interactive map, and users here will get the ability to focus on specific sub-regions and what's going on in the region as a whole. Categories A, B, and C, these 3 tabs, focus on different stages of regional elimination and the countries grouped within them. They contain malaria indicators to define based on what's most informative for the countries, and graphics showing progress over time. Financing and cross-border are both thematic tabs, as I mentioned. Financing is the first of our thematic areas. Financing data over the current and previous funding cycles can be found here, together with funding breakdowns at the country level and at sub-regional levels. Cross-border, use of cross-border transmission within specific sub-regions, and strategies and interventions employed by the countries to tackle the issue. And finally, country profiles. This is a massive tab with a drop-down menu containing 22 profiles, one for each relevant country, with indicators related to epidemiology, policy, financing, and JETSI. Individual country resources can be found within their profiles as well, and I'll go into that in a little bit more detail later on. Every tab is fully exportable in PDF format, as well as as in PowerPoint format, so you can export the entire screen on a PowerPoint slide if that's what you want. So before I move on, I'm just going to talk a little bit about Leaders Dashboard. I've described it as a regional overview, and that's exactly what it is. It highlights key elimination metrics drawn from the World Malaria Report, as I'm sure all of you are very familiar with, the Global Fund's information that's all publicly available, and countries' national malaria elimination or control programs. So this dashboard provides an overview of strategies and interventions, epidemiology, elimination policies, financing, and cross-border efforts. So this is what our new dashboard is going to look like, specifically the Leaders Dashboard. So I'm going to focus on each section, piece by piece, each feature, I mean. So this is interactive map. Over here at the top left of the screen is a feature that we really like from the old dashboard, and we've decided to preserve it in this new dashboard. It contains the 22 countries, each color-coded by category, and selecting specific countries changes the surrounding indicators, as you will talk a bit more about in the next slide, accordingly. Preset regional groups are available for selection, with countries sorted according to WHO classifications, intergovernmental organizations, and regional groupings. So for instance, if you want to see the specific countries in ASEAN, or ASEAN as a whole rather, you can click on one of these buttons. I know they're really small. You can click on one of the buttons and you see just the ASEAN countries among other classifications that exist. And of course, selecting ASEAN, for instance, will adjust the indicators surrounding it to reflect your selection. And these are the indicators I was just referring to a second ago. So we have 6 indicators to the right of the map and 3 major indicators below. Our design thinking here was, if you only have 1 minute to look at this dashboard, what are indicators most important to you? And so the 3 indicators below the map are indigenous cases, reported deaths, and the funding gap. So these are 3 critical indicators that we feel are really relevant to policymakers and decision makers across the region. Similarly, to the right of the map, we have 6 indicators: distribution, the presence of task force, reporting from the private sector, legislation to make malaria notifiable, strategies addressing importation, and funding by source. All of these change depending on which country or countries you select on the map. We've also included a cute little elimination timeline over here. Now, at this point, I just have to say, everything that you see here is ultimately still an early build, and the dashboard will be complete really soon. However, please do not take anything here as gospel. There will still be further changes in future iterations of this very same dashboard. But in any case, the elimination timeline identifies countries in the targeted years for elimination. It also identifies countries that have achieved elimination, so as to provide a visual guide as to when countries are expected to hit their elimination targets. And finally, we have a heat map, which is all the data above presented in the form of a table, sortable all by descending order, similar to Microsoft Excel. If you can sort all the columns according to from largest to smallest, which I think will be very helpful. And that's the Leaders Dashboard for you. We now move on to country categories A, B, and C. So prior to dashboard refresh, countries were color-coded in red, yellow, or green, according to the map I showed you, to indicate the progress and indicators related to the 6 roadmap priorities. However, with several existing indicators and no way to view a country's progress relative to multiple indicators at the same time, assessing a country's actual progress was really unintuitive. It was convoluted. You could select 2 different indicators and the country would change color twice, and that wasn't very consistent. You wouldn't really be able to tell how well a country is doing or not. So to simplify the process, we have grouped countries into 3 broad categories in which indicators relevant to the category can be viewed in the same place. Now, we initially considered working with existing metrics like the WHO's stratification of high, moderate, low, and very low transmission areas based on API values. However, further analysis on our part suggested that GMP criteria simply cannot be applied to countries in the APAC region, as the population sizes in some really large countries skew the overall figures. So we had to do away with using API as a method of sorting countries. So after lots of stakeholder feedback, we decided to group countries based purely on disease burden, almost purely on disease burden, in which countries with 0 indigenous cases make up the first category. So as you can see, category A is countries with no PF or PV cases and the WHO certified malaria-free countries. Category B countries form 99% of the malaria burden, And all the countries working towards elimination are part of the third category. So as I go through what the tabs look like across categories A to C, please note that the tabs are structurally identical, but the indicators to the right of the large diagram vary across categories. So, as is the case with the leaders dashboard, the data behind the indicators all come from the World Malaria Report, the Global Fund, or directly from the country programs. So this is what category A looks like. Countries within this category are either certified malaria-free or are working towards certification. And these countries focus on maintaining a fully functional surveillance system to prevent resurgences. The 5 countries here are Bhutan, Malaysia, Timor-Leste, China, and Sri Lanka. So the tab includes a main indicator in the form of a bar chart with further 6 indicators to the right, or related to deaths, percentage of population protected by ITNs, percentage of confirmed cases investigated, legislation to make it notifiable, strategies addressing importation, and the funding gap. So the indicators here were chosen on the same grounds as those selected for Leaders Dashboard to provide a good cross-sectional view of progress towards elimination. So they illustrate the country status in the areas of epidemiology and financing, as well as policy relevant areas. So by definition, category A countries do not detect any indigenous cases. So, and preventing reestablishment of malaria through imported cases is their priority, which is why the big chart over here to the left is all about imported cases over time. So mousing over the individual columns will show you the individual number of cases recorded by each country that year, providing more information. And this concept of mousing over the different indicators to provide more information is a recurring thing throughout all our tabs on the dashboard. And just below that, we have a summarized set of country profiles with information from the indicators above at the bottom of the tab. A regional profile with summative information is also available. Something similar can be seen in category B, of course, structurally almost identical, except the main indicator here is about indigenous cases. So the high endemicity of malaria in countries in this category poses a significant public health challenge. These countries are mostly in the phase that we used to call burden control, although of course they present a high degree of heterogeneity in the distribution of malaria, and they might be starting to work on or implement localized strategies. So I won't go through each of these individual indicators other than all the countries here, but like I said, they remain structurally identical. There's a country roundup at the end, individual country profiles summarizing the data above in the form of a little card. You can take a screenshot of it. It's perfect for reports, as well as a region profile that wraps up the region. Similar to the previous tab, you can mouse over each column or each ring for more information. Category C countries are countries that have moved beyond what we used to call the burden control phase towards what we used to call the pre-elimination phases and elimination phases. So countries in this category tend to have strong surveillance systems, consistent vector control initiatives, good diagnosis and treatment protocols, and start planning for WHO certification in a non-exhaustive list. So once again, everything here is structurally the same. And we focus on indigenous cases here, similar to category B. And of course, if you mouse over each column or each row or each ring, you get more information as well. And of course, right at the very bottom, you see the indicators above apply to each country. So we move on to financing now. And in this initial form, AppleMa's dashboard aimed to track solely indicators specifically related to the 6 roadmap priorities. But that was a simpler dashboard for, frankly, a simpler time. And as the regional malaria landscape evolves, a clear understanding of the region requires sharing the spotlight with certain thematic areas. So at this stage, we put together tabs with information on financing and cross-border elimination, in which data specific to these areas will be presented, along with additional information and commentary on the relevance to elimination efforts at the regional and national levels. So this is what financing looks like to us. This tab illustrates the proportions of funding each country receives, together with their funding gap, which is the amount needed to meet their funding needs. So understanding funding and its gaps over time provides additional insight towards areas like allocation, prioritization, and sustainability. Large gaps result in challenge, like insufficient human resources and commodities. So the 3 main areas of funding within the APAC region are the Global Fund, international partners like organizations like WHO, the Bill and Melinda Gates Foundation, and funding from bilateral relationships, as well as domestic funding, which is funding directly from a country's national budget. So our primary feature is a stack column chart illustrating funding proportions across the 4 categories, 3 of which I just mentioned, and of course the funding gap. Mousing over the columns, to the surprise of no one, provides the exact percentage and dollar amounts for each category. There's a toggle function right at the top, allowing you to look at the funding cycle, the previous funding cycle, in addition to this current cycle. We provide a funding breakdown applied to specific country categories: APAC, South Asia, GMS, and Melanesia, as well as global fund defined regions like Southeast Asia and high impact Asia. I have to specify that this is defined by the Global Fund, and some countries that you would otherwise not associate with Southeast Asia show up over here, which is why we've made it its own category. And finally, and this is of course subject to change, it is just something that we are considering including, is a section on country pledges, which is a recognition of country funding towards the Global Fund. These figures apply to specific pledge cycles, and while malaria can be a rather depressing thing to think about and work on, this is a section of positivity and affirmation, reminding us that everyone is involved in the fight against malaria. The second thematic area in the updated dashboard focuses on cross-border transmission, which is an area of growing concern to countries closer to elimination. While indigenous cases can be eliminated through strong domestic policies and good resource management, cases occurring along international borders are difficult to address and even harder to anticipate. So according to WHO, countries aiming to eliminate malaria should address this as quickly as possible because it usually takes a really, really long time. So the problem of cross-border transmission requires further study and analysis. APLMA hopes to contribute to this advancement through the creation of this tab on the dashboard. So this is what it looks like. The graphic at the top of this tab is a static image. So for once, it's not interactive. Well, for now, at least, maybe one day it will be. This illustrates subregions with major cross-border transmission, along with the countries that make them up, the constituent countries. So I won't go into great detail on what each of the subregions mean. Other than that, subregion 1 includes Iran, which is not typically a country that we focus on. But if anything, its inclusion here further illustrates to us that cross-border transmission is a massive problem, and it can come from places that we wouldn't otherwise associate with the region. Additionally, we'd like to point out that not all the figures shown below in this sub-region breakdown are necessarily from the constituent countries, because as we're well aware, cross-border transmission can come from countries that are far beyond any of these countries. They could come from other parts of the world, like Africa, for instance. Anyway, a series of toggles in this section will allow users to view sub-region level imported cases by country. So hopefully this will be of use to anyone interested in cross-border transmission. And finally, we're looking at country profiles. Like I said, we have 22 countries and 22 profiles. Every profile has been curated. So all of them will include a country description of key information, including where they are, the year of elimination, and when they became signatories. It also includes key indicators, lots of epidemiology indicators, all on the same page. We have 12 of them. I won't go into each one of them, but largely speaking, these indicators are numerical in nature, and they present themselves really well in the form of charts that illustrate progress over time. And just below that, we have a section on policy. These indicators are categorical, yes or no in nature, and sometimes countries simply don't provide information, which is why they're left blank. But where possible, we have always placed the information right there. Key indicators on financing and JETSI. JETSI is a new one, and we intend to give it its own tab later on, but I'll talk about that in a little while. So financing is largely the same column that you see in the financing tab, and JETSI for now is just 2 indicators that we intend to expand much further later on. On the resources section, we will have 3 to 5 links per country containing NSPs, key policy documents, country-specific material focus on material related to data. And of course, well, what's next? We do have some limitations on this dashboard, I'll be honest with you. It is far from perfect, it's far from the finished article. The dashboard has been updated to a significantly improved user interface and better visualization. However, the indicators used are part of our legacy data set, and the data that we have has been obtained from the same sources since inception. So a goal for our revamp is improve usability of the data, and while data from open sources simplify the process of data collection, what we want to do is we want to collect data from more sources, allowing reducing uncertainty and allowing countries to use, or rather users to use our data for modeling purposes to greater effect. Another challenge we faced is variability in data, which is simply that we can't just use data from a specific point in the year. If possible, we want to collect data as often throughout the year as we can at as high a frequency as possible. And that's something that we're working to address. It is not the case right now, but at some point we will. And finally, the scope of the indicators. So the indicators that we have are once again legacy indicators, and we will work together with stakeholders as we have to refine them, to make them more accurate, and to provide information about the region increasingly higher quality. And what comes after these? Improvements indicators, like I've mentioned, as well as thematic dashboards. I've shown you dashboards on financing, on cross-border transmission, and future iterations of this dashboard will include things dedicated to JETSI, to climate change, and zoonotic malaria that we have planned for future builds of this dashboard. And with that, thank you so much for listening to what I have to say about Applemar's dashboard. I think it's time for Q&A, so over to you, Anushka.
Thank you, Sean, and thank you to all of our three speakers today for the very interesting presentations that you all brought us through. I know there have been a lot of questions in the Q&A box, and thank you, Dr. Helen and Radi, for addressing quite a number of them while the webinar has been ongoing. I think there are some really rich questions and answers that have been already answered. But just so that we have the opportunity to discuss some of the questions that have been brought up, maybe we can start, since Sean, you just wrapped up your presentation on Applemar's Leaders Dashboard. There are a couple of questions around the financing data that you presented on the Leaders Dashboard and where that and how that's been derived. I was wondering if you could jump a little bit into that to share Applemar's thought process behind the financing data. Sean, you're on mute. You're still on mute.
Okay, can everyone hear me now? Yes, I think it's fine. So I see a question on funding gap and how we calculated it. So this information comes from the Global Fund data, as well as various country programs that we've spoken with. And how accurate is it? Well, it is where the data from the Global Fund is concerned, it is fairly accurate in the sense that that's exactly how much they've contributed. Does it cover the estimated requirements from both the government and civil society organizations? Honestly, I think the point behind collecting a lot of data, whether it's related to this or in general, is simply that we try our best to be less wrong rather than be 100% accurate, because it is always extremely difficult to get 100% accuracy, because countries can easily revise what they want at any one point, and of course it can completely throw us off. But yes, we're doing everything we can. We're speaking with all the relevant people. We obtain data from as trustworthy sources we can. So yes, all the information is reasonably accurate for use, I think. Or if it's not, then it will be.
And perhaps just one follow-up question for you, Sean, because you did talk about zoonotic malaria, and there is a question in the Q&A box that says, does the indicator that reflects the percentage of the population not protected by ITNs and IRS, does that also include risk of zoonotic malaria?
Thanks for that. Yes, I see the question right now. So the short answer is we do not have it right now, but of course, the tab on zoonotic malaria, JETSI, and climate change will all come later, and we're currently collecting feedback on the various things that could go into them. So if it is at all possible to calculate this data, if it's at all possible to obtain this data, maybe someone else is already collecting it right now. If there's a way to do it, we will do it, we will find it, we will include it. However, because owing to the legacy data set and the fact that this is not something commonly collected at the moment, we do not have it. But at some point, we probably will. So thanks for asking that.
Thank you, Sean. Maybe let's move on to one of our next speakers. So, Radi, I know you've already responded to this question in the chat box, but I thought it was a really interesting one because you did talk about how, the data collection which is happening through the MEDB, it's it's improved since the beginning, by leaps and bounds. But there are still some data points that the MEDB and WHO are focusing on collecting, such as foci data and things like that. So, there is a question around what can be done to avail some of this data, and would these include targeted responses other than case investigation and case management? And I was wondering if you could just share your thoughts around that with the group.
Yeah, thank Anushka for pointing out this question again. Actually, I have answer in the chat box, but again, just to emphasize, so now we have no foci data in MEDB. So what we supposed to point out is based on the reporting unit. I mean, data from reporting unit, for example, from that health center or commune, we assume that the foci may be there, but it's not 100% accurate, because sometimes the case might be diagnosis in the reporting unit, but coming from somewhere else. And then with foci data, it can help to inform with concrete evidence where the transmission actually occur. That's might be helpful for the resource deployments and responses in the right place.
Thank you, Radhi. And then Dr. Helen, again, you too have responded to all of the questions that our participants have asked, but I want to pick up on one of the answers that you mentioned, and you mentioned the SysMal for information systems, which is a huge part of health information systems in Indonesia, and I'm wondering if you can speak to how that links with the new cross-border dashboard that is also being developed, which you shared about earlier in your presentation. So if you can share something about that, that would be really helpful. Dr. Helen, you're on mute.
Yes, thank you, Anu. For SysMal, of course, as our main of information and surveillance system for recording and reporting for malaria in Indonesia, and also in SysMal we have individual data from all the health facility, and we have like more than 12,000 of health facility that reported in SysMal, and also in SysMal we have the data for the receptivity area, and even for the GIS data, and for the logistic and human resource data. Of course, for the dashboard, it will be linked to SysMal, and SysMal still our main of data. It should be separate, because in dashboard it's only for cross-border purposes. For now, we're using with the collaboration with Timor-Leste, but in the future we might apply it to all the cross-border area with Indonesia, like PNG and Malaysia and etc. Maybe that's Anu. Thank you.
Thanks, Dr. Helen. And I think you touched on another point that someone brought up in the questions about other borders shared with other countries, and if there's anything being done in that space. So it's really hopeful to know that this is something that Indonesia is looking at growing if there's success, and of course we certainly hope there will be. So I know that we have gone a little bit over time with this afternoon's webinar, but I would like to thank all of our wonderful speakers and participants for joining today. I think it's been a very rich discussion about data and dashboards, and I'm sure there's plenty more that we can think about and take away from this discussion. So I, definitely hope that we can continue to have discussions around this very important topic and engage with the rest of the APNIN network and beyond, of course, to continue talking about data in the context of malaria elimination, especially in our region. So thank you all for joining, and over to the APILMA to Pon for any follow-up. Thank you, everybody.
Thank you.